for joining our webinar today. My name is Lizzie. I'm the go-to-market leader at Log My Care, and I'm delighted to host this webinar with our guests, Emma and Louie, today. Our topic is what outstanding learning disabilities providers do differently, and why this topic and why now. If I mention the letters CQC, I'm sure that's going to put it into context for you immediately. There are a lot of changes, a lot of new requirements, a lot of new nomenclature that's coming around the new CQC frameworks. So we wanted to really focus on how we can help our care providers, our customers, our new customers move from thinking about what they could do differently and how to get to outstanding. We've run some research, which we're going to talk you through, just in terms of looking at CQC reports of requires improvement and how those providers have moved to outstanding. What are the key things that make a difference? As I said, I'm joined by Emma from Peak 15 and Louie from Care Research. They're going to join me in a fireside chat shortly. But ahead of that, I'm just going to walk you through some of the key findings of our research. And as I said, why this matters and why now. Before we dive into that, in case you don't know Log My Care, this is just to give you a quick snapshot of who we are. We are a digital care management platform, so a DSCR. We are on the NHS Assured Suppliers list and currently work with about 2,000 care providers, really across the sector, all care settings, all care types. One of the key things to highlight, though, here is about 80% of our customers are rated with CQC, either good or outstanding. And that move being on the NHS Assured Suppliers list has been cemented recently by passing the MODS requirement. If you follow me at all on LinkedIn, you'll see that I'm obsessed with talking about this, but it really is a key move, making sure that data can be easily migrated and that we have common fields to make sure that structured data can be used for all of our reporting. When we think about the scale of our impact, these are some of the kind of customers that we work with, including Peak 15, Emma's alma mater. But all of these providers have one thing in common, that they want to make sure they have the best evidence to provide to the CQC and to get their services to outstanding. So we have a couple of polls for you to make this session interactive during the webinar today. And this is the first one. We'd love to get your thoughts as to what extent your current care management system is really designed for learning disability and complex care. So we'll launch the poll now. And if you'd be kind enough to give us your thoughts and responses, and then we'll see what that looks like across our audience. I love watching these, how it changes as we get some more responses. So we've got the majority so far adapted from a generic system. And by that, we mean mainly built for elderly and then applying that in learning disability context. So very interesting. And I hate to say kind of what we expected, especially given what we know about the market today. My job, not surprisingly, is to talk to new providers in the market, see what they're doing and understand if Log My Care is a good fit. And this is really interesting. As I said, the majority here, 49%, are working with a generic system that works well enough. I guess the question is, would you say that care is good enough, or do you want care to be exemplary? And again, that's where we're really working with our current customers and current providers to get them into that really optimized scenario to enable you to deliver the best care possible. So moving on from our poll to bring you some insights into the research that we carried out, just to explain what that actually was. We looked at 50 CQC reports, and if you haven't already downloaded this report, it will be fully available to you. I think it's been promoted in emails ahead of this webinar, and it will be available to you afterwards. So across those 50 reports, there was really quite a widespread across 35 providers requiring improvement and 15 outstanding. And what we were really trying to understand is what makes the difference. The premise of this analysis was saying, what do those outstanding providers do that really puts them in that category? And one of the really interesting things and key things that came out of it was, it wasn't about more information or more data. It was about doing more with what you have. Currently we are all talking, extensively about, have we got the right data? Do we need more data? Is it in the right structure? But the reality is, unless you actually do something with that data, it's just a completely redundant exercise. And when we looked at this across, as I said, learning disability, mainly residential providers, there were 3 key patterns that came out that we'll talk to in detail in just a second. The first thing was around incidents. Incidents being an opportunity to provide care. When we think about data, it's with actionable insights. Again, no point in having data for data's sake. So once you've got that information, what do you actually do with it? What patterns is it showing you? And we'll dig in a bit more into what that actually means specifically around incidents. And the second thing was about showing a clear path on goals and outcomes. This is quality of life. This is impacting how people live their day to day. This is not a box ticking exercise. And again, outstanding providers were really clear on showing how they were able to not just go through, here's a goal, yes, we've achieved it, but what did that actually do to improve the quality of someone's life through their care? And then the last point, probably closest to Emma's heart, is around quality assurance. So if we can spot trends, spot insights early and do something about it, that means we'll be more likely to be in that outstanding category. Again, I'm sure you will see very often about providers running mock inspections. The reason they do that is obviously to see, where there are gaps and spotting them ahead of time so that they can take action. So if we just take that first theme around outstanding providers treating incidents as an opportunity to improve care, we have some really interesting feedback that's come out of the reports. And this was about spotting those themes and patterns. When we demonstrate with Log My Care, we show different scenarios, for example, around ABC behaviors or behaviors that challenge, and try to show, for example, if that's repeatedly in the living room or it's with one individual, that is an opportunity to really change and act on those insights rather than just obviously keep doing the same things and expecting a different outcome. And again, when we look at how that panned out across outstanding versus requires improvement, outstanding providers consistently spotted those themes and patterns in their incident data, and then when acting on it accordingly. So getting that information and then going, clearly there's an issue here, and then quickly, not in the next 6 months, like in a matter of weeks, really trying to make a difference immediately. The second theme that was really evident was about using evidence around goals and outcomes. And, just going back to our poll about using a system that's been adapted from something generic or something more focused on elderly, we've really heavily focused on goals and outcomes, really for 2 reasons. We want to understand what being genuinely person-led or person-centered means, and then how that's evidenced back as to how a provider actually acts upon that. And again, when you look at the data of how outstanding providers are evidencing that, it's 100%. It's always thinking about, how are we showing that this isn't just about, I wanted to go to the shops or I wanted to buy my own shoes, but what difference that person wants to work towards independence. And that's really the outcome, rather than just, again, that box ticking exercise. So we have another poll for you now. This is thinking on that theme about outcomes and goals. How easy is it for you to evidence goals and outcomes in your current system? So we'll be very interested to see how this comes out. Emma, I hope you're answering this one too. So interesting that we're trending towards manageable but takes extra work. Again, what we're trying to ensure is that it's really straightforward for you to just show that progress. And, an outcome is about either a consistent outcome or a progressive outcome. It's not a one-time thing. So if you are constantly having to spend extra time trying to find out, what's actually happened, so to the manageable but takes extra work, that's time, as we all keep talking about, saving all this time in social care is a complete myth. It's not, it's repurposed. Emma had a fantastic quote about this, which I'll let her share in the fireside. So really clearly, manageable but takes extra work is the theme here. And again, that time could be way better used somewhere else. And what we're trying to do, the very premise of having a goal and an outcome, again, is to improve quality of life. If we're still spending time on admin and trying to evidence that, it's slightly self-defeating. And then just coming on to our last theme, moving especially around quality from that box ticking exercise into really evidencing how care has improved. Again, outstanding providers 100% reflecting back and saying, if we've got issues, for example, around mobility, it's not just about knowing that, it's doing something about it and really showing, answering these questions, for example, around how has care improved, what have we learned, and what have we done with it? Yes, we might have PBS documented, but what's the changing practice that goes alongside that? So very clear in terms of, I guess, in a similar way to the incidents, but this was about other issues that could actually support that overall quality of care. So some very clear themes there, and we will touch back on these in the fireside chat and as our key takeaways. But talking of fireside chat, I know that you've come not necessarily to hear from me, but from our guests today. So I'll let Louie and Emma introduce themselves, and then we'll kick off into our questions for our panel.
Emma, you start.
Thanks, guys. Hi, everyone. My name's Emma Smith. I'm a Quality Assurance and Compliance Manager for Peak 15. We are a provider based in Surrey and West Sussex. We support adults with a learning disability and autistic adults across residential services, supported living services and community outreach.
And hi, I'm Louie. I'm the founder of Care Research. We do a lot of work, particularly around CQC and helping people feel ready for CQC. We also do a lot of work around feedback surveys, particularly accessible feedback surveys. How can we get the views of everyone, not just those who perhaps could use traditional pen and paper or traditional spoken interactions? And a month or so ago, we were very privileged to take on and run a learning disability conference. And it's become a real centerpiece of who we are. That actually, we want to make sure that the learning disability community and services feel supported, feel they have a voice and are heard, because we all know, we've all been to the wonderful care shows and it's 99.9% elderly care, and we want to make sure, as everyone on this call does, that LD is given its rightful place and gets that support that it needs.
Amazing. Thank you both. So Emma, we're going to kick off on our panel discussion. Obviously, some really interesting findings in that research. And in your role, obviously being responsible for quality assurance, it would be interesting just if you could talk us through some of your challenges within your organisation and how they reflect back to some of the findings that came out of that insight that we looked at.
Yeah, absolutely. So I found the research really interesting. There's nothing surprising there. The thing that really stood out to me was the quality assurance statistic, obviously. So 94% of requires improvement services had quality assurance in place, but they weren't able to spot the gaps and the issues before an inspector did. And that really makes me think of a time in my career where we did have requires improvement services. We have had that experience in 2 of our locations. And the first time we got requires improvement, that was a real shock to us. So we did not see it coming. And I'm sure there's providers on this call that can relate to that. And there was many reasons as to why that service got requires improvement. It was in the middle of nowhere, really hard to staff. They couldn't access their local community without driving into the nearest town. But one of the pieces of work that we did was we looked at our audits. Mm-hmm. And actually, when we looked at our audits in detail, it was more like a box ticking exercise. It was more like a checklist. And we had people going into that service. We had people visiting. We had regular audits. But our audits were only showing us a point in time, and it was only showing us what we were doing, not how it's been done. So it was asking questions like, are support plans in place and are they up to date? Yes or no? Are risk assessments in place? Are they up to date? Yes or no? So it was very much looking at a point in time, and we did have systems in place. They weren't being used particularly effectively, but But basically what it showed us was that we were only seeing a point in time.
Oh, Emma, we've got you back. We heard you up to a point in time.
Technology. So yeah, our audits were only seeing a point in time. So they weren't showing us the quality behind that care. You know, just the time that we would go to the service, we were seeing really good stuff. But we weren't seeing the quality. And I think a lot of that comes down to the language of the audits that you're doing. So we really looked at our audits in detail and we changed them to say, instead of looking at all the support plans and making sure they're in date and they're up to date, it was, okay, check 2 support plans and check them for quality and do they relate to people's needs. Check 4 risk assessments, for example, and do they meet people's needs? So we found that actually it changed the culture of our audits completely. So instead of people focusing what's being done, they were finding the gaps, which is great. That's what audits should do, action planning them, and then actually being able to draw out the good and outstanding stuff that they're doing day to day. And then a couple of years later, we had our second requires improvement service. And actually we had audited that service 2 weeks prior, and we had noticed all those gaps before the inspector did, and we had actually noticed more than what the inspector had found. So to us, that really did show that audits are really important, and it's the language that you use when you're auditing.
Definitely. And I mean, you mentioned culture there. How hard was it to get everybody to buy into this new approach? Because obviously, you know, that, as you say, first time was a bit of a shock. Second time you could see it coming. But in terms of getting everyone to buy into, we just need to operate in this way now. How did you do that?
Well, I think for our managers, you know, they don't want requires improvement services. You know, they don't, you know, they want the good and outstanding stuff to be drawn out. And I think the key thing for us is our staff and our managers weren't recognizing what was outstanding because they just thought that's what we do, and they weren't drawing that information out. Something that we do within our organization is our management team audit each other, and I'm there very much as a guide and a coach, and because there's no point me as a quality assurance lead knowing all this information, you know, because I don't do anything with it. I don't manage services. It's really important that our managers have that knowledge and have that confidence in inspections. So I think our managers bought into it really quickly because they were able to see the benefit of auditing other services, because they would go to another service and say, oh, I really like the way they do that. I'm going to do that in my service. So actually, I think you know, it wasn't so hard to get our managers to buy in because they did really want that outstanding practice and that good practice drawn out in their audits.
Interesting. Thanks, Emma. And I mean, Louie, maybe just if we touch on that, this is kind of going from, I guess, mock inspection is the next stage. Audits is one thing to find out, you know, where you are. Just in your experience of then taking that into mock inspection, full inspection, you know, how do you think services can really sort of get ready, get ahead of the game?
Yeah, I think there's a couple of key things. I think one of the things, and we discussed about this previously with audits, is it's also thinking about who is involved in that process, who gets visibility. We know of some organizations, not Peak 15, don't worry. We know of other organizations where there's this separate group of mythical people that turn up and do an audit, and they go back to their office with their audit, and you kind of sit there and think, you know, it's almost like an exam where you don't really see the result. And I think making sure that people are empowered to know what the audit is capturing, to know what the feedback from the audit is, and actually to enable some people within management to actually not audit themselves fully. Obviously, there might need to be some external oversight, totally get that, but for them to at least to be able to sense check and be able to keep abreast of these issues themselves is really important. I think another thing when it comes to the whole kind of inspection piece is actually helping our whole team understand what this is all about. What we have found is that most services have managers and leaders that are very clued up. And if they are large enough to have quality teams, of course, that's their bread and butter. But then the actual staff on the ground that are providing care day in, day out, CQC rock up and they have absolutely no idea what is happening. They don't really know why this happened. We've had services where staff thought that they were in trouble. They thought it was like the police, like the fact that CQC are here, it means that they've found something bad. And so they're now on like terrified defense mode because these people with suitcases turned up and they had no idea it was happening. And the fact it was a surprise made them think it was like a police sting operation. So obviously that's an extreme, but for the majority of individuals, there is a lack of understanding around what the whole CQC process involved, why it matters, why it's important. And I think that point that Emma made around sharing the excellent stuff, I do some training with care staff, and I always do a question, I go, tell me an example of someone that's changed over the last 6 months. And some of the stories are just insane, like people that were moved into a particular service for hospice care, and now they've been alive for like 2 years and they're dancing, and they're, we've had individuals who were very restricted in terms of their mobility, and now they're up and moving a lot more. People that have moved back to solid foods when they've been off solid foods for sometimes years. Individuals who were very grumpy and upset and never spoke to anyone, and now they have a little social circle. And the staff don't realise that these are the kind of one step back from a miracle. Like what they've done is incredible. But because it was just, this is what we do. People turn up like this, then 6 months later, we support them and they're like that. But they don't realise the stories they have to share. I think a lot of assessment, certainly on the ground level for staff, it's about storytelling. And storytelling in the sense of telling the realities of what happened. I think a lot of people in services are so obsessed with just the data, they don't communicate the story. And actually, CQC inspectors, for now, are not AI robots. They will actually process the stories a lot easier than they will process 400 pages of MAR charts, important as that is too. We have to get the human narrative in front of the inspector.
Absolutely. And I mean, what you've just described, it's the journey, isn't it? And it's that, thinking about what's improved. Care plans will describe a person's needs really well, but actually what we want to know is what's improved. So, I mean, as you say, that's the storytelling, but how do you really evidence that progress in practice? And actually, what do you think stops providers from getting there?
I think if I just quickly jump on, and then Em will give a much more useful answer. In a broad sense, my 2 categories that I always say when we're training staff on this is improvement, change. Improvement, change. Something that you've changed or something that has changed or improvements been made. Those are the 2 fundamental categories that you want to consistently be capturing. Has there been a change? Either we have made a change or there has been a change. Has there been improvement? Those are kind of the 2 fundamental strata. And I think we focus so much on things being as they should be, when really we should be focusing on where has there been change, where has there been improvement. That's where we get to head towards the outstanding, where we can show, actually, here are all the improvements that each individual person has made over the last 6 months that we've supported them. That's when we're heading towards outstanding, not just here's how we've kept everyone going over these last 6 months.
Yeah, it's a difference.
Emma will have, I'm sure, much more detail.
Isn't it?
Yeah.
I mean, Emma, obviously want to get your thoughts, but also, like, from your experience, what would stop somebody getting there as well? So as much as thinking about that improvement journey, like, what could get in the way?
Well, I think there's so many things. There isn't a straightforward answer to that question. I think there's so many things that can get in the way, but I think Louie's spot on with that, really, that, I imagine we have so many teams within this call that they have not had experience with CQC. We've had services that have been inspected in 7 years, 8 years, 9 years.
Wow.
And the majority of our staff team probably have never had experience of a CQC inspection. And when they have outsiders come in, like Louie said, they get scared. They think it's they've done something wrong, and that is why they're here. And I think language is really, really important. So, we use all these buzzwords like data and analysis and all of that, but you say that to a staff team and it sounds overcomplicated than what it actually is in reality. And data and analysis, that really is just numbers and information telling you a story. And when I speak to staff teams and I say, can just tell me about this person's journey, tell me a story about them, they say, okay, that's really straightforward. And they could talk about that person for hours because they know them so well. And that's when you're going to draw out the really outstanding things they're doing. You're going to draw out the outcomes, the goals. And that's the vital stuff in inspection, that when they're speaking to an inspector, those conversations, that storytelling is going to be really vital. And it's just building up their confidence to be able to tell someone's story confidently, with an inspector. And I think goals, as well, I think a lot of people focus on, okay, a person's told us they want to achieve this goal, and that's great. There's nothing better than a person you're supporting telling an inspector all the great stuff you're doing. But in our world, the majority of people that we support, they can't do that. So it's really down to the staff teams recording that. And as I said earlier, I think our staff teams don't record it because they're doing it. And they're more focused on doing it very well than recording it very well. And they just think, well, that's just us. That's just what we do. Well, I didn't realize that was outstanding. Something as simple as you spot a change in someone's presentation, or they've got a new behavior. You work really closely with health professionals and you find out actually it's a physical health, it's illness, or maybe it's a hernia, and you've supported that person to get the same kind of surgery that the rest of us would get. That's a fantastic outcome. We work in an industry where I hear it all the time, where professionals will say, oh, there's nothing wrong, it's just their learning disability, or it's just their autism, or actually it's just a hernia, it's not causing any problems, we're not going to operate. And I just think, hold on, if that was me, you would operate on me, so please, can you do the same for the person I'm supporting? And pictures as well, I think, are really, really impactful. Seeing someone's, you might see someone engaged in a new activity and that's a new hobby, that's a great outcome. So I think sometimes people focus on goals, on people that can tell you their goals, rather than logging goals for people that can't and showing their outcome.
Yeah, that's really important. We hear that a lot, especially about, as you say, photos, videos, and probably calling it evidence is maybe really underserving what it actually is. It's just like, this is what we're doing, as you say, every day. And maybe if we could switch back to thinking also about incidents. And we've heard from customers where they've had up to, incredible stats, reduction of 92% in incidents. And Emma, you've obviously only recently joined the Log My Care family, but you've already got Log My Care running across 6 sites. And you came from a more generic care management platform. So what was that like previously in terms of your understanding of incidents across the services? And then what's really changed for you on that day-to-day, especially for your supported people, since you've had Log My Care in place?
Yeah, so just to give a bit of background, so like many people on the call, we used to log incidents on a piece of paper, and I think again that was very much like a box ticking, where you just log the incident because that's what you should do, because you need to notify people, and it gets filed somewhere and you don't really look at it. And then we went on to a digital care system. About 10 years ago. It was built for elderly care, but kind of adapted to meet our needs. And we started to get really great insights on a location level. So we were able to see how many incidents we were having, what type of incident, and we were able to see if there's been an increase or a decrease. We were able to see, incidents like medication errors. So I could see, at one location, they've got 2, at another location, there's 1, another location, there's 2 medication errors. And I couldn't get that group oversight. As an organization, I couldn't see how many incidents and what type of incidents we were having as an organization. So that really drew us to Log My Care because of the group dashboard. So previously, we just would pull that information manually, or if I'm being completely honest, we would just look at it at a location level. And you would think 2 medication errors here and there, 1 here and there isn't that big a deal. But we've got about 26 locations, 6 of them have joined Log My Care just under 2 months ago. And within the first month, we already saw, okay, something's going on here, we need to focus on it. So something I always say is that technology does not save you time. It really does not. It just focuses your time where it needs to go. Social care takes the time it takes, but it just stops you spending time on things that you don't need to be spending time on. So within the first month of joining Log My Care, those 2 medication errors here, 1 there, we then saw actually we've had like 10. And when you look at that, you think that's actually quite a lot. And all of them, and the technology was showing that all of them are human error. So it started to focus us on, okay, let's look at our medication provider. Let's look at how the training is being done. and let's maybe explore an EMR system, because we don't have an EMR. We've never felt the need for one. But we're already starting to get this information from our systems that focus our time in the right places. So that has been really great for us. We've been able to have group-wide visibility. And something that's been really refreshing. So as I said, we've been with our previous provider for 10 years. But we've been with Log My Care for about 2 months, and I'm a part of the beta group for their insights dashboard, which is their group's dashboard. You know, they're really taking our feedback on, and we're already starting to see changes within the system that we suggested, and we've only been with them for 2 months. So things like that is really important for you to have good relationships with your technologies that you use and the software, and being able to have that group visibility. Has been really key for us. So I'm looking forward to our other services coming along, Log My Care as well. So I'll probably see other things we need to focus on, you know, and that's really exciting for us.
And that's, I mean, you know, just hearing about your experience in that customer group, you know, we often talk about co-development, and, you know, we want our customers to tell us, and actually, you know, there's a great example of how that has translated into the product really quickly. I think sometimes it's just like, yeah, is that you're just saying that? It's like, no, actually, we really mean it. And how would you say now this is going to help you prepare differently for CQC inspections?
Well, I think, again, another buzzword in our industry is lessons learned, and we as an organisation do have a learning log, and I think it's really important to capture that learning that you found changing software and why you're changing, and I think all of those learning pieces we're going to be looking at, and that again will be evidence for us as to how we've improved our care or how we run a service.
Great, thank you. And then Louie, we mentioned audits and culture a little bit previously, and you know where we see that gap. So I mean, what Emma thought was happening, she knew there were some meds errors, but actually there were a lot more than she thought there were. You know, getting that visibility. Why do you think things like that keep happening in services? Because obviously everyone's really trying to do the right thing. No one works in care because they wanted to like learn a piece of technology, but also like generally everyone's just trying to do their best and do the right thing. So, you know, what's stopping this optimal scenario becoming a reality?
So I think there's a couple of things. I think one of the challenges around care as a sector is it's incredibly human, but actually there's more patterns than we think there are. Does that make sense?
Yeah.
Like obviously everyone's individual, but also if you have 150 people with autism, there's a large chance that a certain subset of situations are going to repeatedly occur. And I think sometimes what happens is as we focus on the individual, as we should, if we don't have the right people and systems and processes in place, we don't get the chance to have the bird's eye view. And then when you get it, you realize, oh, actually, this wasn't a one-off. It was like, if something's a 17 off, it happened 17 times, it's actually a pattern. And I think a lot of the time, the day-to-day workings mean that everyone are having these little moments that are very similar, but they're not being triaged. They're not coming together. And I think that's where the systems become really powerful. That's where helping people understand process and systems becomes really important, because when everyone is kind of cohesive in that way, we start to see situations and we can start to make plans that have a much bigger effect than, oh, I do this for so-and-so because that's how he likes it. I do this for so-and-so because that's how she likes it. And I think that's about three things: about having systems that enable you to see all that. I think Emma's got a great example there with the med errors. It's also about knowledge and understanding, helping your teams know the part that they play in all of this. I do think still we do a lot of care staff training, and we still find that there's a big them and us between management and teams. Like it's, even if that person has gone from being a staff team into a manager, they suddenly become them versus us. And I think there's a real challenge around enabling staff to feel that they are the essential part of this puzzle. And I think making sure that they recognize in a way that doesn't feel like they're being given more responsibility, actually all of these processes, these systems, it's not something that the quality lead or the manager does and you can just carry on doing what you do. actually there is a cohesive way that we can all work together. And I think we sometimes miss things because we're waiting for the quality lead or the manager to spot them. And that's really about ensuring your team feel like they understand their part in all of this. Because to be really blunt, if you don't introduce and explain to your staff their role, they will assume that it's someone else's role.
Yeah.
And I think that's a big piece with tech. We kind of get it put in and we kind of tell them how to use it, but we don't really bring them in to the process and the whys and the hows.
Yeah, and that's a super interesting point. And actually, I was just thinking, Emma, when one of our first meetings, we came to visit your team. I mean, there were about 25 people in the room, and with some very strong things that they wanted and equally things that they didn't want. And just having that level of insight from the beginning. But you obviously, made that happen. You facilitated that and, brought them into the discussion. And I think that's made a huge difference just to how your teams have engaged with Log My Care, as not thinking of it as just a technology platform, but it's an enabler now. It's all those things we talked about, like, yeah, I can do that. I mean, it's, love to get your thoughts on those early conversations that we had and what difference that made.
Yeah, I mean, we started our tech journey a really long time ago. So we've been on technology for over 10 years. And I'll be honest, we made a load of mistakes. We implemented technology right before COVID with the panic that we'd have to do everything online. And we basically just put tech in services and expect people to run with it. And of course, it didn't work. So we learned a lot from that experience. And when we started to reintroduce technology or change the technology we were using, we really made sure that we had buy-in from people from the beginning. So one of the first pieces of technology that we implemented was a rota system, or reintroduced, and we had champions across the business. We had people from our HR, finance, operations teams, managers, all involved in those early discussions. And then when we decided to replace our digital care monitoring system, we sort of did the same thing. So we started out telling a story, basically. This is what we're struggling with as an organization. Is anyone else having any problems in their services with this digital monitoring system? And what would you like the outcome to be? And I always had kind of Log My Care in the background because we were having some early discussions. And that's when I would kind of sense check with you and I and say, well, do you have this? Or is there a possibility for this? And then we made sure that those managers, because they're the ones using it day to day,
absolutely,
they were involved in the demo. So I would kind of sense check software and go, okay, are the managers going to like this? Our staff team's going to find this easy? And then we brought that to our managers and had a live in-person demo, with tablets playing around and yeah, lots of managers asking lots of questions. But I think that really helped with the buy-in to culture, because then they knew that they were asking for this, basically. It wasn't just being given to them and done to them. They were actually asking for this. And yeah, then the expectation to get it rolled out really quickly was really fascinating. I'd never had services come to me and say, when are we going on? When are we going on? It's usually trying to put it off for as long as you can. So that was really lovely for us. And I think phasing people on and having enough time to play around with the system and having some training with the care team again is really important. But I think sometimes us as providers, we feel this panic and this rush to get systems changed or get systems in place, because there's contracts and you kind of make decisions really quickly. But if I've learned anything, you just really have to take your time.
Absolutely.
And don't feel pressured, to sign a new contract really quickly or to renew a contract. Always look around and see what's out there and try to find a system that does more for you than what you actually need. So there's nothing worse than having a system that you pay a lot of money for and you only use a small part of it, so.
Absolutely. Yeah, no, that's great feedback, Emma. Thank you. And I mean, just obviously, bringing this back to where we started on the research and this journey from requires improvement to outstanding. If you were a provider in this room or another provider in this room, just thinking about what you've learned and what you've seen come out of those insights, if they could change one thing today, what would your recommendation be of that one thing? So Louie, maybe come to you on that first.
I think for me, the key recommendation is make sure that you are capturing living voices. So what is the change? What is the improvement? And what are the experiences? So make sure that anything that you're capturing is human and living, because it's those stories, it's those narratives that enable CQC to understand what your service, the impact of your service, and its impact that starts to head towards outstanding. So yeah, capture the voices, find ways to capture the voices, make sure that you have got change or improvements noted down for everyone so that people can get a real sense of the impact you are having, not just the standards that you consistently meet.
Great. Thank you, Louie. And Emma?
I would say if you're a provider and you don't feel you have visibility of all of your services, then get visibility. I think you really need to see what's going on in the day-to-day and not just when you visit a service. I think that's really important. And also, don't focus so much on what's being done. I think focus more on how it's being done. I think sometimes auditing can feel really overwhelming for managers when you're constantly finding gaps. I think find the gaps and action plan it, and then draw out what's good and outstanding about that service.
Great. Thank you both so much. Just fantastic insights, real on the ground experience, which is invaluable. So I'm just going to move on to our key takeaways. You have to excuse me coughing. We've had some, I'm just looking at the chat, there are some great questions in there. Some I can answer, I think definitely some for Emma and Louie in there, which we'll come to in just a second. But just coming back to the key takeaways, both from the conversation and from our research, really the first one is around that visibility. And again, as we've said, not visibility for visibility's sake, but having an actionable insight. But if you don't understand, it's the classic, if you can't measure it, you can't manage it. If you don't know what's going on, it's absolutely impossible to be able to take action and spot those patterns and trends. So really being super clear, using Emma's meds errors example, that is really the difference that that insight can have. Telling the stories in your evidencing. So again, what Louie was talking through, that human voice, what's actually going on with your supported people, making sure the team can really capture those everyday moments and those things that make a difference to somebody's life. Again, what we're trying to ultimately all do is improve the quality of a supported person's life. And then lastly, about change and impact. Those are some of the things that really move the needle from requires improvement to outstanding. And this is a journey. And I think, we just need to be realistic about this is not 1 week being it requires improvement, exactly as Emma described in their services, and the following week we're at outstanding, but showing that evidence that's meaningful, things that actually can precipitate a change and have impact, and then seeing how you can really socialize that across the organization, embed that in culture. We've had a lot of questions about, how do we get the team to engage with technology? So I think we've definitely covered off some of that, but making sure that we really are monitoring and recording so we've got that clarity. So I'm going to pause there and hand over to Marion, who is our head of marketing.
Hi, everybody, and very good to meet you. So as Lizzie mentioned, I'm head of marketing at Log My Care. We've had so many brilliant questions come through on the chat. So if you have any more, please do drop them in now. I'm posing them to our speakers. So I think the first one is for Emma. Would you mind sharing how you found the transition from your previous digital system to Log My Care?
Yeah, of course. So well, it was an interesting journey for us, I must be honest. So we were with our previous provider for 10 years, as I said, and I wasn't there when we signed the contracts. And I think over the years that digital monitoring system had changed some of their terms and conditions. So it was actually a really easy process going from a digital care monitoring system, going from one to the other. The issue that we had was the contracts piece and the notice period with our previous provider. That kind of slowed us down. So I would definitely recommend that you know what contracts you have in place, what are the terms and conditions, and what are your notice periods for them, because that will really help you understand timescales. And we were really fortunate that we were able to have, you know, Log My Care run alongside the other system for some time to be able to play along with it and transfer some data over. But when we changed our rota system, that was really complicated, you know, because it's pay and it's finance and it's HR, but a digital monitoring system is actually really straightforward, and it didn't take us long at all. The issues we had were more around the contracts with our previous provider.
Brilliant, thank you very much. I'm going to switch slightly to a more CQC related question perhaps for you, Louie. So this is from Hassan, and he would like to know, how does CQC account for the variation in acuity of residents in homes? So, for example, one home might be dealing with a lot more complex cases than another.
Yeah. So I think the first thing is you need to make that abundantly clear in the initial conversation or initial meeting. So they will speak with you. They're not just going to suddenly turn up at one of your sites having not spoken to you. You will be at best forewarned, but hopefully the first half a day at least of the inspection, they will sit with you. And I think the first thing is for you to make that abundantly clear. If it's pre-written down, that's going to help. The last thing I want is for you to get a piece of paper out and start scribbling it there. If you can show very clearly, these are the setup of our homes, these are the makeup of the people that join the homes, that's really important. So you set that scene. I think the next thing to highlight with that is to basically help them understand what they're likely going to see in each service. So obviously, if you have multiple registrations separately registered, CQC are obviously going to inspect those completely separately. What I'm talking about here is if you've got, say, supported living, you've got a bunch of locations under one registration, but within some of those small locations, there are different levels of acuity. That's where it can get a bit complicated because it's one inspection, but it might be 3 or 4 or 5 or 6 or 10 very different small properties. You just want to give people an oversight of what to expect. One of the things that we're very keen on when we speak to services, to learn with services, help them understand whether people are going to be able to communicate with them or not. There are some services where 3 people with briefcases turning up is going to cause a real challenge for those individuals that are supported. There is nothing wrong with explaining the makeup of the people you're supporting in those services, and where the way you frame it is these services, you're going to get a better perspective on the day-to-day because they will be able to engage with you. They will be able to function with you present. Perhaps home A and home B, I can support and come with you. But if you go in on your own, the individuals that are being supported, there's going to be some distress. It's going to cause challenge. You do have to remember that you are the expert in your service, and CQC are there to get a clear picture of your service. And so anything that isn't quite going to work, you frame it as you're not going to get a clear picture of this service if you do X, Y, or Z. It's not about hiding things. It's about helping CQC understand that to get the best sense of this, do it this way. But I think you need to kind of take the lead in that. You need to be clear and you need to explain this would be the best approach to capture what we do here. I think that's the way you frame it.
Brilliant. Thank you, Lee. There's a couple more questions on CQC, but I'll circle back with you in a second once I've digested them. So Emma, I'll come to you next. This one is around goals and outcomes. So if clients are non-verbal, what is a good way of evidencing client goals and achievements?
Well, there's so many great things you can do, and it really does depend on the people you're supporting. But as I said, I think it's photos and the things that you're recording, the language that you're using within your care notes and within your care plan. So sometimes what we see is that care plans will really be focused on what are their needs right now. And that's great because staff need to know, how do I support this person? You know, if I don't know them, I'm new into that service, what do I need to know? But actually you can draw a lot of evidence through your the language you're using in care plans. So if you say over the last 2 years, this person has found a new hobby, and that's because staff have offered them lots of different activities, that's going to show you that there's been some improvement, that there's been outcomes, and just using really simple language with your staff team, getting them to be able to tell someone's story. Sometimes it's not always about a specific goal. It's more about being able to evidence how that care has improved over time, or have you had reductions in behaviour. But also you can just log simple goals and the steps that you've taken. So if somebody maybe doesn't have capacity around money, and you would like them to have more choice or more freedom with their money, or shopping, it could be something as simple as, testing, can they hold their purse rather than staff holding it? And that could be a really simple goal, and you can have, some evidence under that, some pictures, or it could be, maybe that person, the GP has said that they're slightly overweight. It would be good if they, lost a bit of weight or ate healthier. Maybe they've got diabetes, and you could log some health goals, and, log that you've done a 20-minute walk this day, a 30-minute walk this day, or a different type of exercise like dancing or something, so you can be really creative with goals for people that lack capacity or are non-verbal.
That's great. A slightly related question around evidencing goals is how to actually improve tech savviness of staff. So Hassan is asking, other than training, what might make it easier for staff to register that evidence?
That's a really great question. And I think you're always going to be battling with that tech savviness. I think like we mentioned earlier, staff don't work in this industry to learn a new piece of technology. I think training's great, but you need to be coaching and showing them in person, so having confident managers that can sit with someone and show them that process in practice from start to finish, and then getting the staff to help each other, because sometimes when you're teaching someone else, you learn better. So I think that's a really good way of supporting your staff teams to log goals better.
If I could just quickly jump in very briefly on that one, I think also it's enabling evidences that are very easy and simple. So it's things like taking a photo, taking a short video, doing a voice note, which actually, my dad's 79 and he's on his iPad all the time. Actually, there's a lot of these things that we do naturally with our phones that if we can translate those into evidence collection practices, that's going to make the jump a little bit easier, because they're already able to take photos and send voice notes and do videos. We just take what we know they can do and help that become part of the capturing those magic moments, those little successes. That's going to be a good starter for them to kind of get going on it.
Brilliant. Thank you both very much. I think just time for a couple more questions. George, I had a question that I hope I will do justice to. So George is coming from a case management company. They're CQC registered. And what she's looking to understand is if her clients employ their own support workers directly, will the CQC ever inspect the clients themselves? And does that change when there are no support workers at all? So just family carers, for example. I think probably Louie, that would be a good one for you.
Yeah, so I spotted that one. I was having a little think whilst also listening, of course, to Emma's wonderful answers. So there's a couple of different moving pieces, and I'd like to say to George, feel free to get in contact with us. We can send you some people that might be able to do a dive on. I think a few core things to highlight. As case managers, you will have core responsibilities in relation to CQC, which you will need to uphold. And so as a result, they may not physically come and visit, but it would always be a feather in your cap if you can provide that visit. If you can enable CQC to visit some of the individual case management examples, it's going to help as long as things are kind of as they should be. What I think you need to really work on is making sure that the oversight structures that you have are very clear, are very understandable, are followable, are traceable, are trackable. What they want to check is that you have really good quality oversight and can ensure that what goes on in that home on a Sunday afternoon is what should be going on. Now, that's going to be your responsibility, broadly speaking, as a case manager in a broad sense. If they then want to go and jump and do a visit, they might have the right to do that. What they would be doing is not necessarily explicitly assessing the quality of that parent. What they'd probably be doing is assessing the extent to which your systems and that which you have put in place is actually working on the ground, and making sure that those individuals who are providing care, whether employed or not, what their perspective and experience of you as a case manager team is. It would be more broadly around, is what you put in place fundamentally seems to be working? What are the perspectives of those individuals of you as a case manager? If you have individuals that you can volunteer for them to visit, whether that be via a Teams call or in person, it's going to be beneficial. If you turn around and say, no, our cases want to speak with you, just speak with us, that's probably not going to put you in the strongest position. That is my kind of start for 10. Again, I'm not sure anyone else wants to jump in on that or has any other thoughts, but that's my initial thoughts working with case managers of how CQC typically handle it.
Fantastic. Thank you so much. I think that's it. I think I've captured almost everyone's questions. There were a few questions around Log My Care, so I've just confirmed in the chat that we very much are fully compliant. We're an NHS assured supplier, compliant with DCB 0129. There's also been lots of chat about EMAR. So it is something that we also offer, and I'd encourage you to visit our site to find out more. If you are interested in hearing more about Log My Care, thank you very much, Lizzie. Here is the link to book a demo, and I'll just post it in the chat as well. And I'll hand back to Lizzie to close.
Thanks, Marion. So we hope that you've enjoyed the webinar today and found it useful, both obviously from the research perspective, but mainly and predominantly, I have to give a huge thank you to Emma and Louie for your amazing insights. Just as I often say to our prospective customers, like, we're not a care service, we're not a care provider, and it's really, we want to help best support the people on the ground, the people doing the hard work every day. So I'm hugely grateful to both of you for, as I said, your great insights and obviously the support that you give us as a business. So thank you again. Yes, please do, if you would like to hear more about Log My Care, use the QR code to book the demo. I'd also like to thank our super marketing team for pulling this together. They've also done an amazing job, so well done, guys. And yes, watch this space for more soon. And if you would like a copy of the report, I think Marion's put a link also in the chat that you can download that. The webinar will be available afterwards. And thank you so much again, everybody. Enjoy the rest of what's going to be a very hot day today.
Thank you.
Bye, everybody.
Thanks,
Bye,
guys.
everyone.
Bye. Bye.